ndị be anyị ọkwanụ maka asị ọcha ka nwata nwaanyị ji wee bụrụ onye akpa nwa ya nalụ na ndụkwa bịakwa nụrụ akụkọ nke a ka isikwa na ya wee mụta ofe ife ma ọ bụ abụọ maka na o nwekwalụ ụfọdụ amara na o nwelu ndị ha ekwesịrị ịtụrụ asị n'ụwa mmadụ ịbụọ kwesịrị ịtụrụ asị n'ụwa onye anụnwa wee tụgide asị wee je tụọla onye arụ ike ya asị ọcha nke meziri na ọ bụzi onye enwerozi akpa nwa ka mụ na gị na-ekwuzi kịta anụnwa ka ọ ghara ịbụ isi nọọsụ iju dị na asị gị biko ka anyị na-anya n'ihe onyonyo anụnwa ka nnachitazi azụ gwazie gị onye nke ịbụọ kwesịrị ịtụrụ asị maka na ọtụtụ ndị ama akwụ ihe a ka anyị gbapụ na ọsọ ndị be anyị ka anyị jee nụpụta.
Stop scrolling and listen to this. I'm so pained right now. There's absolutely no reason why you should lie to your doctor. I've said this before, but there's no reason at all. Everything you tell your doctor is kept in confidence. And I promise you, most of us would not judge you at all because we've seen worse. This lady came to the hospital and her complaint was that she was bleeding from her vagina. What she said is she had a period for longer than normal. And when we examined her, we had a list of diagnoses that were possible. And I asked her, look, are you okay with having your mom here? Because this was a 24 or 25-year-old lady, for which she said yes. And I asked, have you been sexually active? She said no. And then when the mom left, I asked her again in private, have you been sexually active? She said no. And then we eventually asked, okay, one of the routine things we're going to do for this type of complaint is to get an ultrasound scan. This lady refused to get an ultrasound scan. And at this time, I believe her mother was beginning to think in the same direction with us, but because maybe there were some elders in church, they were in denial. The mom was in denial, and she also refused to get the ultrasound scan done. They said it was her period. We should give her medications for them to go. Eventually, they left the hospital against medical advice. Fast forward quite recently, this lady was rushed into the hospital. Now, it was no longer blood that was coming out. It was pus. Pus was what was coming out from this lady. The lady was also in acute kidney injury. She was already having acute kidney failure because there was an infection in her womb. At this time, of course, we were forced to do an ultrasound scan, which showed that there were remaining products of a baby from her womb after an abortion that she attempted. For which, if this lady told us the truth, we would have removed these products since, and she probably would have gone home fine. Now, but what happened? By the time we examined and took her in, this lady had parts of her uterus were already necrosed. She had suffered necrosis. For those who don't know, necrosis is when cells die. The only way to save this girl who was already having acute renal failure was to remove her womb. This is a 24-year-old unmarried Christian lady. So in an attempt to cover up shame from her church, this lady has lost her womb at a very young age, an unmarried lady who has no child at all. I say it again, there's absolutely no reason, no benefit for you to lie to your doctor. Thank you.
Efi ụfọdụ ndị mmadụ na-eme kedu ka ị ga-esi tụgide nnaasị tụọla onye ọrụ arụ ike gasị n'ezienye ya kedebe chie na ndụ onye nke abụọ ikwesịrị ịtụrụ asị bụ ọka iwu gị nya bụ lọya gị ọ bụgodị na ịbụ onye asị nya na-asị gị na-apụ ọkụ nya na-asị nke gị bụ na ikeregodi mmadụ eke n'ụtụtụ ọ pụta na o kwesịrị ijegodi nya anya na aka erekere tupu ori ọbịakwe gị maka na ekene gị bụkwu dị asị atụkwana alụ onye ọrụ arụ ike gị asị atụkwana alụ onye ọkaiwu gị asị nya bụ dọkịta gị na lọya gị bụ ndị kwesịrị ịtụrụ asị n'ụwa kedu ihe melụ na ọ gwarozi onye ọrụ arụ ike ebe ọ bụ na ọ na-ezobie nne ya nọ okwere ekwu ka ezikwana ihe mee na okwu ozi ihe na-emie mgbe onye ọrụ arụ ike pụrụ o kwete na ọ bụ kedafia na ọ bụ Virginia ọ dị nke ọma na ọ bụ Holy Nweje ngwa n'ezienye ọma mmụzi nwa n'ụwa ọma mmụnatakwazi nwa n'ụwa maka gịnị maka asị ọcha sikwa na ihe mere onye ọzọ wee mụta akọ sikwa na nke mere onye ọzọ mụrụ ofu ma ọ bụ abụọ biko ịgba mbọ na-atụsi ihe onyonyo a enyemaka ị ga-enye bụ ị na-atụsi ihe onyonyo a ka ndị ọzọ wee fụkwu ya ka ndị na-akwadobe asị ọcha ka ha fụkwu ya makwa na efe enye ekwa makwa na azụ adị ọkwanụ n'isi azụ makwa na o nwekwa ife a na-azụta n'isi azụ ekwuchekwa m ekenekwa m maka na ofu mkpụrụ okwu ezugokwala onye mara mfe kedu ihe ọzọ m ga na-ekwu ndị nke m na-abụrụ na udo ga na-achịrịrị kwudochia na ụmụnne maka ndị chọrọ udo.